The FDA is banning red dye number 3 from food, drinks, and medications. This comes nearly 35 years after the dye was banned from cosmetics. KVUE's Daybreak takes a closer look at the decision to act now when it comes to foods.
A monumental victory is what some call the FDA's new ban on red dye number 3.
Red dye number 3 has been controversial for a long time.
It's a synthetic color additive that companies put into food, drinks, and drugs to give them a bright red color. It's been more than 30 years since scientists discovered its links to cancer in lab rats. UT Professor of Nutrition, Cellular, and Molecular Science, Dr. James Fleet, says the change mainly comes after a push from multiple advocacy groups, not a new study.
They've reviewed it a bunch of times and had previously decided they weren't going to ban it. So today was a little bit of a surprise in that regard. On the other hand, Europe doesn't use it. Some other countries don't use it. We already took it out of cosmetics and ointments for medical purposes.
UT Assistant Professor of Instruction, Dr. Elizabeth Klinbile, says she's not worried that this dye has been on the market for so long. She says there are bigger concerns like maintaining a balanced diet to fight obesity.
It's not from a negative health outcomes for humans concern. It's something that has been popularized in just general consumers. Right now, we actually don't have any clinical evidence to show that it does do anything negative in humans at the dosage we currently consume it.
The animal studies show that there's risk. It's a very, very low risk. And I think maybe they're going for a zero risk sort of mentality now.
Plus, there are natural red dye alternatives without the risk. Food manufacturers will have until January 2027 to remove the dye from their products, while drug makers will have until January 2028. In the studio tonight, I'm Darynisha Heron, KVUE News.